excited to talk with you all today about medical cannabis and CBD for juvenile spondyloarthritis. So bear with me while I share my screen here. All right. Let's see here. Sorry. All right. Can you all see this? Okay, hopefully you guys can see all this okay. So I'm Dr. Chin. I'm an integrative physician, and I've been treating patients with cannabis and CBD for 2 decades. And I was a patient before I became a physician. As a teenager, I was diagnosed with juvenile ankylosing spondylitis. And as we all know, it's a progressive arthritis that affects the spine, the hips, the pelvis, and the back. And I had extreme stiffness and nerve pain. I spent my younger years trying conventional treatment, narcotics, muscle relaxants, NSAIDs, epidurals, trigger point injections. I did alternative care like acupuncture. I did physical therapy, but the pain was just unrelenting. And by the time I got to medical school in San Francisco, I was having a really hard time standing. I was having a hard time assisting in the OR, being an intern, for example. I'd wear this back brace. And I remember pulling it so hard and so tight just to get some stability and decrease some of my back pain that it would create lesions on my ribs. And one of my attending physicians, one of my mentors, saw me struggling and asked me about it. And I told them I had AS, but that I couldn't take any medications really because I was doing rounds. I was working in the hospital. I was attending and assisting with a hip replacement surgery in the OR. I couldn't take the risk of being groggy or feeling altered in any way. And that's what all the pain meds did for me. Now I had the best pain specialist in town. I had access to dozens and dozens of physicians, and I tried medications like gabapentin. When that didn't work, we tried a muscle relaxant like baclofen. When that didn't work, we even tried different antidepressants that could help, that may or may not help with some of the pain and the nerve pain and inflammation. I was given Oxy as well. And that made me really nauseous. I took all these different medications, so I was given anti-nausea medications. And then when that didn't work, they said, well, how about you try some high-dose steroids? And I was on prednisone. So really here I was in this hospital. I was surrounded by great medical minds, but I was really disheartened that no one could help my condition. I tried everything. Now, I remember one day my physician, my attending, Dr. Levine, he pulled me aside and he handed me this tincture bottle. And he said, this is marijuana, but it won't make you high. I mean, this is, the early 2000s, late 1990s, around that time. And he didn't call it CBD oil or anything fancy like that. He just said, this is a different type of cannabis plant. And I was mortified because here I was a medical student. I was training to be a doctor. And my first thought was, this guy, my mentor, another physician, is offering me pot. Does he want to make me a drug addict? I grew up in the Bronx, and there was this huge social stigma around cannabis, around marijuana. Kids that smoke weed, in my mind, were either dropouts or maybe they were involved in gangs. And I also grew up in a very traditional Chinese household. My parents believed in reefer madness. They believed that weed led to psychosis and schizophrenia. Well, this little brown dropper bottle that Dr. Levine gave me, I remember it smelled awful. It smelled like alcohol. It smelled like grass and wet dog. It was thick, and I didn't know what to think. And I remember I sat on my dresser for a whole weekend, and I would just stare at it. And I was at this point where I couldn't even sit down to study for more than an hour. I couldn't stand up to do the dishes, for example. It was just so uncomfortable. And I remember Dr. Levine said, with AS, you're really not going to make it through residency. That you can't stand, you can't do the functions that a normal physician in training would do. And so I was at this crossroads. I said, I am going to really have to think about dropping out of medical school or trying this god awful smelling tincture. Now, just to give you context, I was in California for med school. California legalized medical cannabis in 1996. Okay. And when I finally decided to try it, I remember I tried it and my pain improved. It was over a weekend. I remember that it wasn't completely gone, but the pain improved enough when compared to the other medications that I was taking. I didn't tell anyone I was using it, right? I didn't want to jeopardize my career. But once I got my health back, I decided I need to learn everything about this plant and why would it work and why wouldn't more physicians know about it? Now, Dr. Levine happened to treat HIV and AIDS patients with it in San Francisco, and that's how he got introduced to it. And I know what it feels like to say, to your doctor, I've tried everything, and nothing has helped. And so I've been helping patients integrate this for well over a decade. Cannabis has changed the trajectory of my life. I would not have been able to finish med school. I would not have been able to become a physician had it not been for cannabis treatment. As a result of my experience, I started helping families figure out how to integrate CBD and cannabis into their healthcare. And my end goal, I treat children, I treat the elderly, I treat the whole family. My end goal is really to help the patient form a therapeutic alliance, right? My goal is really prevention, proper nutrition, right? Talking about foods to avoid flare-ups, and then always supporting the patient no matter what type of questions they have without stigma and empower the patient. So with a background as a physician, I'm also a mom. I have 2 teenagers at home. As a chair of the Health, Safety, and Research Committee for the New York State Cannabis Control Board, I really offer a well-rounded understanding of cannabis from a medical perspective, a social perspective, and from a legal perspective. So I emphasize that education in cannabis research and science is really essential for harm reduction. If you look at our world right now, cannabis has transcended from going to recreational to medical use, and it has a really significant societal factor. So I have patients, I have young people that are asking, what do you think about cannabis? And they're being exposed. And whether, we are pro or against it, it is important to emphasize harm reduction, to emphasize the science, to emphasize the research, and to really prioritize safety and empower young people, young patients, to mitigate any potential negative consequences. Equally important, it's really important to understand the legal implications of cannabis use, right? That's really important because we want to educate our young people, educate parents, educate families about cannabis laws and regulations, right? This knowledge prevents any inadvertent legal violations that could jeopardize young people's future opportunities and goals. So today we're going to get into it. We're going to talk about the difference between marijuana and hemp. And here's a close-up picture of marijuana and the hemp plant. Could you tell the difference between the two? I'm going to break down the basics, the difference between marijuana and hemp. And the differences is really based, it's a little bit confusing, but the differences is significant enough. And the thing about cannabis is they all derive from the Cannabiceae family. And that's the name of both the cannabis and hemp plant, but there are differences, some biological and some cultural. Well, the hardy hemp plant can grow up to 13 feet tall, tends to maintain and easier to maintain than other cannabis plants. It's because it's typically grown for seed production. Hemp leaves are thinner. The main differences is between hemp and marijuana is their genetics and how they're cultivated. So the stalk of the hemp plant you see here, they're very fibrous. The fibers can be used to make rope, textiles, animal feed, and other different products. It could even be used to make bricks for construction and fuel to run vehicles. Now, hemp plants are considered phytoextractor. And that's a big word for basically nature's natural vacuum cleaner, if you want to think about it. A phytoextractor means that they remove dangerous compounds from the soil. So it helps suck up heavy metals. It's like a hyper accumulator. So a lot of times they'll be planted in soils that contain dangerous compounds, or they'll be planted in soils so that in case they want any cleanup. So for example, hemp was planted at the site of the Chernobyl nuclear meltdown to help decontaminate the soil at a rapid rate. Sometimes land developers will plant hemp around old, abandoned toxic factory sites for that phytoextraction. So you really think of that hemp plant as a natural environmental vacuum cleaner, just sucking the pollutants out of the soil. And then hemp seeds can be found in supermarkets, right? You may already be eating hemp seeds in your granola, your nut, or your seed bars. You can sprinkle them in your cereal, your yogurt, your salads, right? Any dish that you might add, sesame seeds or chia seeds. And then most industrial hemp has a THC content of less than 0.2 to 0.4%. So meaning it is not intoxicating. THC is what is part of the plant, is a molecule part of the marijuana and hemp plant that makes you high, but not CBD. And this is important to understand, and I'll go deeper into it, but CBD does not make you high. It's the amount of THC that makes you high. So hemp does produce CBD in its flowers and the seeds and the stalks. CBD is a powerful anti-inflammatory, and that's why it's so important in the cannabis plant and the hemp plant, and why it helps decrease inflammation. So let's talk about the marijuana plant and how it differs from the hemp plant. Marijuana is the intoxicating cousin of the hemp plant, okay? So while marijuana and hemp might share species, they're legally and chemically very different. The high levels of THC in marijuana plants, that's what causes that high, that intoxication, that euphoria. Marijuana is a cannabis plant that contains more than 0.3% THC. And again, hemp contains less than 0.3% THC, okay? THC is found in these resin glands located at the buds and the flowers of the female cannabis plant. Now, because industrial hemp isn't cultivated to produce these buds or flowers, it doesn't produce a high THC content, and that's the difference. So let's recap the concepts here. You have hemp and you have marijuana. The main difference is in this THC content. Hemp, less than 0.3% THC, right? So there's no high, there's no euphoria, there's no sedation. Marijuana is greater than 0.3% THC. And then again, the uses for hemp: clothing, rope, shoes, carpets. Hemp can be made into paper, CBD oil, CBD capsules, CBD topicals. So then what's marijuana used for? Well, marijuana is used for different medicinal and adult use or recreational purposes. Marijuana contains large amounts of THC. It does cause that high feeling or that euphoria. A lot of cannabis users consume high THC marijuana for pain, inflammation, for anxiety. And marijuana plants tend to be short. They're dense, they're bushy, they have broad leaves situated along the stalk. Marijuana plant height is dependent on the strain. Indicas are short. Indicas are short and unlikely to grow any taller than 6 feet, while sativas can go up to 20 feet. And then hybrids of the both can be either short or tall, depending on whether they're like an indica dominant strain or a sativa dominant strain. Again, hemp plants are very slim and tall, and they reach over 20 feet. Okay, so these are the main differences. So I also want to talk to you briefly about something called the endocannabinoid system. Okay, we probably didn't learn about it in science in school, but to really understand how cannabis works in your body, I really need to talk about this endocannabinoid system. We learned about the digestive system in school. We learned about circulatory system, our respiratory system, how we breathe. We learned about our nervous system, our immune system, our lymphatic system, right? Our nervous system. Well, this endocannabinoid system is very, very important. This endocannabinoid system, think about it as lying over or interfacing with all of those other systems that you learned about in science. It's the master regulator of the human body. And the endocannabinoid system is like a dimmer switch. Think of it as it adjusts to the level of light or heat. So it regulates blood sugar. It actually regulates your immune function, your hormones. It regulates how we feel pain, how we feel pleasure and metabolism. So it really is a very, very important part of our system. It modulates different systems in our body. And scientists that are studying the endocannabinoid system are realizing how important it is, because it comes into play when we eat, it comes into play when we relax and exercise, when we have sex, during pregnancy, even when we nurse a baby. So that ECS really regulates your nervous system and your immune system. So let me show you this PET scan. Everything you see here lit up represents the galaxy of endocannabinoid receptors in your body. Look at it, it's everywhere. It's everywhere. It's in your heart, it's in your digestive system, it's in your liver, your uterus, your testes, your immune cells, your connective tissue. I mean, where is it not located? So that is why the endocannabinoid system is so important. And then you can start to see why, when you see the press about cannabis medicine, why it might be used for all these different conditions. Chronic pain may be used for nausea, and then you hear about it being good for migraines and anxiety. Then all of a sudden cancer, right? Alzheimer's, MS, PTSD. It's because those receptors are all over in the body. That's why it works on an array of conditions. So the cannabis plant is very, very complex. It's not a simple plant. There's over 500 chemical compounds, okay? 500 chemical compounds. And in these compounds, I'm just going to break it down briefly for you, are terpenes, cannabinoids, and flavonoids, okay? So in the cannabinoids, which is the molecule of the cannabis plant, you have that THC and CBD that I was talking about, right? There's over 1,500 strains. You know, we call it chemovars. The layperson call it strains, but there are over 1,500 strains. These different strains are indica or sativa or a combination of both. And you might have heard of it. Blue Dream, Sour Diesel, Wedding Cake, OG Kush, Girl Scout cookies. There are many, many, many strains out there. And Cannabiceae, like I mentioned before, is that genus of the flowering plant. Everything falls under that. So you have the sativas, you have the indicas, and you have ruderalis, which is less commonly used. Okay, so the cannabis products derive from the indica species. So you'll hear of people talking about the indicas in cannabis plant. Indicas tend to be more relaxing. It provides more of a body high. And sativas are usually more stimulating. And that's why you hear the difference between the sativa and the indica. And then sometimes there's a combination of both. Now, terpenes is what gives cannabis that pungent smell. So a lot of folks usually think that smell of that potent smell of cannabis is that skunky smell is the THC is what's making you high, but that's not true. That pungent smell is actually terpenes, and terpenes is the essential oils of the cannabis plant. And those essential oils of the cannabis plant is actually quite beneficial as well. And then we have that THC and the CBD. So CBD, again, does not make you feel high, and CBD can actually offset that THC high, believe it or not. So when there's a combination of THC and CBD in the medical cannabis formulation, which I'll go into in a little bit, that CBD can sometimes be there to offset that high of the THC. So THC, these are the therapeutic qualities. It gives that intoxicating high. It gives you that sedating, relaxing feeling, reduces pain, relaxes muscle spasm, stops nausea and vomiting, stimulates appetite, right? That's why we use it for cancer patients. Gives you the munchies, right? And decreases anxiety and depression. So it helps uplift your mood. And some studies have shown, and these are animal studies, that it has anti-tumor effects. No, that's not a cure for cancer, but there are some animal studies that do show that it does have some effects on tumors. So I do want to point that out. Now, there are side effects of THC, and some of these side effects are dizziness, dry mouth, cotton mouth, drowsiness and fatigue. If you're smoking THC, side effect is coughing and phlegm. And then some people, if they take even a little bit of THC or too much THC, they might experience anxiety if in certain cannabis strains. Some folks will experience worsening nausea or cognitive changes, short-term memory loss. Some side effects, as I talked about, is that euphoria, headache. It can lower blood pressure. It can cause depression. It can increase your heart rate. It can cause vomiting and diarrhea. CBD is non-intoxicating, so there's no high. Actually, it could be alerting in low doses, sedating in high doses. It reduces pain and muscle spasm. This is why it's so great for arthritic changes, for joint pain. It stops nausea and vomiting. It reduces anxiety and depression. It's an antioxidant. It's an anticonvulsant. So it's actually used for seizure patients, and it helps protect the brain. A big side effect of CBD is GI upset. So almost a feeling of indigestion and diarrhea. But normally this is not caused by the CBD. It's caused by the oil that the CBD is in. Sometimes patients are just super sensitive to that. So the terpenes, of what I discussed you before, the terpenes is what gives that smell molecule to the plant, and it's the essential oil of the plant. And you actually know what terpenes are. Terpenes can be found in other vegetables, in other herbs like cinnamon, ginger, cloves, thyme, and rosemary. All of those have different terpene profiles. Terpenes give the color and smell of taste in certain fruits and vegetables. And these are the different terpenes you see here. There's myrcene, pinene, caryophyllene, limonene, terpinolene. These can be found in the cannabis plant. So there's certain strains, for example, that might smell more citrusy, right? If you have a more citrusy strain, then it has more limonene terpene in it. If you have a cannabis strain that has a more pine smell, that means there's more pinene terpene in it. So that's the differences between the different terpenes in the strain. There are many ways of delivering cannabis into your system, and there's pros and cons to each. And we're going to go through each one so you can understand. Dried cannabis flower is the most widely used form of this medication. They're typically identified by strains. Now, the thing about the cannabis flower is when you inhale it, it is immediate, right? It will work within 10 seconds to 30 seconds. It will last about 1 to 3 hours. There's vaporizers. Vaporizers heat oil, so it comes in a little oil cartridge, and it heats this oil at a lower temperature than with a dried flower, for example, like burning a joint. The vaporizer is odorless and smokeless, so a lot of patients will use it if they're concerned about the smoke and the odor of the dried flower. The onset is immediate, and again, it lasts about 1 to 3 hours. Now, the thing to watch out for in vape pens is oil cartridges that are thinned with a chemical called PEG, or polyethylene glycol. It produces a hazardous chemical byproduct which actually destroys lung tissue. If you remember a few years ago, that was this whole vape health issue, and that was from vape cartridges that were found in the illegal market. And the substance that was causing pulmonary harm was vitamin E acetate, and that was linked to the lung injury and chemical pneumonia. And there's one way to avoid all of this is really to buy vaporized cartridges in the regulated state-run dispensaries. There's sublingual tinctures, so it comes in a little tincture bottle, and these are much simpler to ingest. It doesn't involve smoking anything or inhaling anything. You put a few drops under your tongue, and it gets broken down by your salivary enzymes, and then it enters the bloodstream. It takes about, I would say, 15 to 30 minutes if you hold it in your, if you hold it in your mouth for 30 seconds and then you swallow it. But it takes about 15 to 30 minutes to take into effect. Some patients, if they are slower metabolizers, it can take about a half an hour to an hour, more than a half an hour, up to an hour. And the duration is a little bit longer compared to inhalation. The duration is about 2 to 8 hours. And then there's edibles. So the edibles are the gummies, the chocolate, candy, infused beverages, right? The onset is, it takes longer because it has to, when you eat it, it goes through your digestive tract, and it takes, usually I would say an hour and a half to 2 hours, sometimes more. It depends on your own metabolism, but it'll last 6 to 10 hours. And I have patients that sometimes say the next day they're still groggy from their cannabis edible, their marijuana edible. So you have to be really, really careful about, how much you're taking. And there's really no way to judge it. And then there's topicals. Topicals are great because you're not ingesting anything. You put it directly on the joint or the ligament or the area, the muscle that's giving you discomfort. Because it's not absorbed systemically, the topicals, you don't have to worry about feeling high. You don't have to worry about feeling altered. Some patients will even use it for eczema and psoriasis because of that anti-inflammatory effect that I talked to you about with CBD. So a lot of my spondyloarthritis patients that have skin issues as well, they will use topicals and apply it directly several times a day. So we'd already talked about these side effects. So just wanted you to get an idea of it again. There's really the most common ones is the dizziness and the dry mouth, the fatigue, the coughing. I always recommend not using inhaled form of cannabis because, even though it's if it's regulated, even though it's, it's from a state regulated dispensary, I always recommend not smoking if you can help it, because you're still irritating lung tissue. It does create anxiety and nausea for some, and it can affect people's short-term memory. And then some of the rare side effects you can see here: diarrhea, hyperemesis, which is vomiting, tachycardia, your heart is racing, depression or paranoia. And I want to talk about vulnerable populations, because this is important, because cannabis is not for everyone. I want to start with pregnant women. Pregnant women should really use cannabis with caution. For when pregnant women tell me that they have nausea, terrible nausea, morning sickness, they're vomiting, I recommend alternative such as acupuncture. They can use things like acupressure or even massage. Cannabis is not recommended as first-line treatment, because research has shown that THC can be transferred through the placenta and the breast milk, and is associated with preterm infants and low birth weight. Now, for youth under 25 years old, did you know that neuroscientists say human brains are fully formed around 25 years old, right? So this is really important. The research shows that frequent cannabis use during adolescence has been associated with alterations in brain structure. These are small studies, but just so you're aware, it does result in impaired attention, memory learning, decision-making, especially for an underdeveloped brain younger than 25 years old. So at 21, the brain is fully developed except for this prefrontal cortex. And this is part of the brain that makes up for the reward system. It regulates impulsive behavior such as self-control and emotions. So during adolescence and young adulthood, when brain development is critical, THC can have lasting effects on cognitive function and mental health. And I always address these concerns with young people, highlighting potential risks. I encourage them to prioritize their well-being over short-term recreational use, which is why I stick to CBD when it comes to young people. And then for psychiatric patients, so let's dive into cannabis medicine and psychiatric patients. Well, research shows that THC will also act on brain receptors that are involved in memory and involved in fear. So CBD can have fear mitigating effects. Animal studies support that cannabinoids, both THC and CBD, can help reduce the fear response. In animal studies, PTSD respond well to both cannabinoids, to both THC and CBD. And then there's a recent study that PTSD patients link their cannabis use with milder episodes of depression, because it actually helped them sleep better. It helped quell some of the nightmares. So that's a really interesting study to pay attention to. But there are important things to consider when you have someone with a history of a psychiatric illness, alcohol, or substance abuse. Individuals with these types of histories may require specialized assessment and treatment, and the use of cannabis may be contraindicated. So it's really important to seek appropriate medical consultation. Maybe it's with your pain management doctor, your psychiatrist, or your addiction or mental health specialist. And then I want to talk to you about immunocompromised patients. So the risk of toxicity from any cannabis product and contamination is really, really of concern, right? Contaminants can result from cannabis that's not grown or stored properly. It can result from cannabis from the illicit market, so not from regulated state-run dispensaries. And these chemical contaminants can really pose as a threat for immunocompromised patients. So for example, I had a cancer patient that came in, and she was getting treated for pancreatic cancer, and her grandson gave her some cannabis that he got through like a friend of a friend. And, I said, well, if you don't know where you're getting it from, you have cancer, you're going through chemo and radiation, you're immunocompromised. So you don't want to use any cannabis medicine that is not purchased from a regulated dispensary, despite your grandson's best intentions. And then it comes to elderly patients. You don't want to offer grandma and grandpa marijuana, because think about the last time you visited grandma and grandpa or an elderly family, a friend, right? Likely there's about 6 to 10 bottles of prescription medications and vitamins sitting on the table, right? Older patients are more likely to be on multiple or learned long-term prescriptions and supplements. So you really want to stay vigilant about adverse effects, right, when prescribing cannabis. And here are the top examples of safe prescribing practices with seniors. You want to make sure to look over their medication list, talk about alcohol intake, talk about going slow and low, making sure that they're not at fall risk, and making sure that you tell them not to use cannabis medicine if they're going to drive or play any sports. So again, I just want to drive home because we are talking about cannabis medicine for juvenile spondyloarthritis. It's easy for young people to get a hold of cannabis. And usually the first form is through a smokable form. And I really want to make sure that you have an open dialogue about your young family members, about scientific research, about using inhalation, and the effects that it has on your lungs, right? So even when you look at the Juul, you look at e-cigarettes, it's the same thing. When you look at vaporizing cannabis, it has an effect by increasing inflammatory cytokines in your lungs. It increases white blood cells like macrophages and neutrophils and lymphocytes, and this is what causes that coughing. So really talking about inhaling cannabis or talking about cannabis in general should be done with your children at any age as part of a normal conversation, but always in an age appropriate manner. And then finally, there's something called cannabinoid hyperemesis syndrome, which you might have heard about in the press. It's a side effect of cannabis. So I do see it. It is rare. It's very rare. I've like, practicing a few decades now, I might have seen it a handful of times, like 5 times maybe. But it's a side effect which involves cyclic episodes, intense nausea and vomiting. Like it's just incapacitating. Like you just can't stop vomiting up to 5 to 8 times per hour. Most patients report taking hot showers helping to alleviate symptoms. Now, research has not really been able to pinpoint what exactly the cause of this is, but you're basically having an allergic reaction to the cannabis. And this is actually associated with chronic users that started at a young age, usually teenage years. So that's actually who I see it the most. Someone that'll come in and say, well, I've been smoking cannabis since I was 13 or 15. And now I'm seeing them for the first time in their 30s or 40s. And now when they use cannabis, they're just vomiting. And this is that cannabinoid hyperemesis syndrome. Usually if you stop cannabis altogether, the vomiting stops. So luckily that you can really go back to baseline once you just stop the cannabis altogether. So in 2022, voters and patients in over 37 US states have enacted medical cannabis legalization, right? And this is basically what it looks like, legalized and not legalized. Every state has its own laws. So that's why it's really confusing. Every state has its own laws and regulations and approved medical conditions, and every products vary from state to state because it's still federally illegal. Cannabis is still federally illegal. US doctors like myself can't prescribe medical cannabis. We can only recommend medical cannabis. And patients are forbidden from crossing state lines with their medications. So for example, I do have a patient with AS. He's 17 and his parents are divorced. He is using medical cannabis for his pain with his biologics. This is what his pain physician has given him. But his parents are divorced. One lives in New Jersey and one lives in Connecticut. And he can't take the medicine from Connecticut to New Jersey, technically. So he has 2 cards, 2 medical cards, and he has to basically has 2 physicians, one in Connecticut and one in New Jersey, and he has to buy different sets of medication. So it is confusing. Cannabis is unique. There's no precedent. There's no other drug in the world that we are using recreationally and medicinally. And I thank you so much for this conversation today. And I want to open it up to any questions.
So much, Dr. Chen, for that wonderful presentation. We do have one question in the Q&A. And that question is, does CBD interfere with TNF inhibitors?
So I have patients that take CBD with TNF inhibitors. So what I usually say, and even with natural supplementation, if you're taking vitamin D, if you're taking echinacea, you want to take, your supplements at least 3 to 4 hours apart from your prescription medication. That's just in general. I do have patients that take it with TNF, but of course you always want to tell your treating healthcare provider that what exactly you're on. You know, if you're going to decide to use CBD or even your natural supplements, they should have a list of the natural supplements as well, so that you're fully transparent. And let's say you do have a side effect, you know, you can try and parse out and figure out, well, what is the side effect on? Is it from this new supplement that I just got online, you know, or is the side effect from my medication, for example? And if you parse it out and take things different parts of the day, you can and keep a log, and you can handle basically the different things that come up. There's another question, what's full spectrum CBD? And that's a great question, Gardner. So full spectrum CBD, there's CBD, full spectrum CBD is all of the cannabinoids with the THC taken out. So that's the plant. Basically, you have the full spectrum. So you have all the cannabinoids, all the terpenes, all the flavonoids with the THC taken out. That's full spectrum. You have broad spectrum CBD, which you might find over the counter as well. So you'll find full spectrum CBD over the counter, broad spectrum. Broad spectrum is everything is the THC taken out completely, and you have certain cannabinoids only. So that's the difference. It's a little bit nuanced. It's a little bit nuanced, but I would say patients end up trying different brands to see what works for them. Let's see, there's a lot of questions coming in. Okay, so another question is, how would you recommend we start out if we want to try CBD or THC? So the number one thing is to talk to your health provider. The most important thing is talk to your health provider, because if you are on other medications, you want to make sure there's no interactions. CBD, even though it is sold over the counter, can interfere with certain blood thinners. So it'll actually make your blood thinners work better. So if you're on, if you've had a history of stroke, if you have cardiac disease and you're on a blood thinner, and you have a CBD on board, it can affect that. So you want to make sure to tell your health provider. And then THC as well. Like I said, if you are on antidepressants or on other certain medications, it can interact, because cannabinoids work on, remember I told you that PET scan, cannabinoids work on all these different receptors, including receptors in the brain, serotonin, dopamine, GABA, you know, the GABA receptors in the brain. So if you're on a mood stabilizer, maybe an anti-anxiety medication, antidepressant, you want to make sure that the cannabinoids don't interfere with that as well. I'm an adult AS patient. Do you recommend a certain type for long-term use? I don't recommend a certain type for long-term use, but as an AS patient myself, you know, I don't think of cannabis as the cure-all, but I think of as one of the things in my toolbox, one of the levers that I can pull when I have a flare-up. So the things that I look at is nutrition. So I look at certain foods. Are there certain foods that flare up my AS? You know, maybe it's dairy, maybe it's processed foods, maybe it's certain alcohol, or if I take too much alcohol or caffeine. Exercise, right? I look at exercise. I look at stress. I look at how well I'm sleeping. Then I look at cannabinoids. I look at cannabis medicine. CBD is what I gravitate towards, because it's such a potent anti-inflammatory. And then I have my prescription medications. So there might be different seasons where my AS is flaring up. So it's not one certain type for long-term use, but there might be 2 or 3, you know, favorite CBD or medical cannabis products that I like, and I might pull on them during the winter months when I'm not as active and I'm super stiff. Or I might use them in the morning only, because it's really hard in the morning for me to get up and get out of bed. So I might use it in the morning to begin my day, or I might need it to sleep at night because I can't sleep because of the pain and the stiffness. So I think discussing it with your health providers, number one, but number two, trying to figure out, which is trial and error, what of these levers do you need to pull on during these different parts of your health and wellness. Another great question is, how long do you have to take it before noticing any benefits? So CBD especially is cumulative. So I would usually say to patients, if you're going to begin CBD, day 1 will be very different from day 14, will be different from day 30. So it does take time to accumulate in your body because it's a natural anti-inflammatory. It's not like you're taking a muscle relaxant. It's not like taking a Valium where you just feel it immediately and all the muscle, you feel sleepy and then or sedated and all the muscles just feel sort of soft and rubbery. CBD takes time, cannabis takes time, and it turns the volume down on the stiffness and the pain. So you might wake up and say, I feel a little bit like my joints feel a little bit lubricated, or I feel like I did yoga. That's what like most patients say to me. Like, I feel like I did a stretch and it feels a little better. And then week 2, you know what? Yesterday I went for a 10-minute walk and normally I can't get up from the chair, but I actually have more mobility today. So they'll notice these subtle things. And that's why I say it's always good to keep a log. That way, when you see your health provider, you can have feedback and you remember, day 1, what it felt like, day 2, day 3, and the different types of cannabis that you might take. How do you determine which brands are okay and which aren't? I always recommend state regulated brands. So I am the chair of the Health, Safety, and Research Committee for the Cannabis Board here in New York. And that's the one thing we talk about all the time is patient safety and regulation. How do we make sure that patients get good products, that it's not passed, 8 to 10 different hands before it gets to you? So you want to, with state regulated products, they're tested by third-party labs. So the company tests their batches, but then the state also tests the batches. They go through audits, they go through compliance. It's more expensive, obviously, but that is the best way to do it. You're not going to, hop on Amazon and buy some random, you're not going to go to a smoke shop in the corner or a bodega and buy some random tincture that's sitting on the shelf. You want to make sure to go to a state regulated place. And one person did write, if your dispensary has a pharmacist, you talk to them. Yes, that is correct. Thank you so much, Jessica. Certain states, right? Remember I told you that each state has its own cannabis law. Certain states require that a pharmacist is at the medical dispensary. So you can actually go to that dispensary, that state regulated dispensary, free of charge. You're talking to the pharmacist and say, well, this is the list of meds that I'm on, tell me about the cannabis products. And that licensed pharmacist can guide you as well. Thank you, Jessica. That's great. There's another question. For sleep, is it true you use 50-50 CBD and THC? Now, that's a very specific question. And I would say the best way to answer that is, for sleep, it depends on you. It's hard to say like this formula will help you with sleep. Just like if you were to come to me and I want to prescribe Ambien or Lunesta or Restoril for your sleep, we don't know, right? We try a low dose for a patient and then we see how you sleep. Some of the things to think about is, are you having difficulty falling asleep, or are you having difficulty in the middle of the night and you keep waking up? Right? If you have difficulty falling asleep, then you need something more fast acting. Fast acting could be the tincture. So you take the tincture and then within a half an hour, good night. But if you're waking up at 2 a.m. and 3 a.m. and 4 a.m., then you might need something like an edible that will kick in a few hours, 3 or 4 hours. And that will sleep, then will take you through the night. So I would say the rule of thumb is that it's not 50-50 CBD and THC. You just don't know. And then talking to a medical cannabis specialist or the pharmacist at the dispensary, they can guide you. I've tried numerous CBD oils that the salesperson guarantees me will help, and nothing has ever taken the edge off. I know you walk in and they're right. Sometimes they're just trying to move products off the shelf, and you're not talking to a health expert, a health provider. The best thing is it is trial and error, yes, to a certain extent, but you have to think about what your goals are. CBD oils will help you with the inflammation part of the spondyloarthritis. It doesn't take away the pain completely, but you might need to use it with your prescription medication. And again, that's why that log is important, because when you are taking it, think about, well, did I take my NSAIDs today? Did I have to use the Advil and the cannabis? Did I use my biologics? You know, how far am I from my injection of my infusion, my injection for the biologics? So it does take more proactive participation, I think, with the health provider and the patient. So you really have to be, you really have to find a good team to work with. Iowa has legalized medical cannabis. That's great. I live in North Carolina. THC is not legal. However, CBD and Delta 8 is. So Delta 8 is derived from CBD, and Delta 8 creates the euphoria, the high, the sedation, just like THC does. A lot of states have banned Delta 8 because it's not regulated properly. It's synthesized through CBD. And this is the issue here, that where the research has not caught up to the science and how processors are able to make these medicines. So I have a lot of patients that find Delta 8 very, very helpful, but you'd really have to look at your state law to make sure that the Delta 8 is legal. I know New York State has banned Delta 8. Delta 8 does occur naturally in CBD, but it's a small amount. But if you're looking at just an isolated Delta 8 product, which is quite strong, that is synthesized, right? So that's gone through processing and manufacturing to create that tincture. So you really, again, want to make sure that it's from a reputable source, third-party tested, and you want to make sure that it's legal. Does CBD help with the fatigue of AS? So the fatigue of AS is complicated because the fatigue comes from that pain and inflammation, believe it or not. When your body has so much pain and inflammation all the time, you could be resting, right? You could be sitting on the couch and it looks like you haven't done anything. But because of those embers of the fire, right? It's still inside the pain and the inflammation. It's exhausting. So because CBD is such a potent anti-inflammatory, it indirectly helps with the fatigue by bringing the volume down on the pain and inflammation. Patients have a little more energy to take that walk, to continue being active, to continue leading a more preventative, healthy lifestyle, right? To prevent disease, to stretch. So I would say yes, CBD does help with the fatigue of AS. I am the spouse of an adult with AS with tincture bottles dispensing at our medical dispensary. Great. Excuse me. I've noticed there's THC mixed with the CBD tinctures, and you prefer only CBD for the spouse. Okay. So is there any harm with this mix? Any recommendations for the ratio? So this is very complicated. I can't really comment exactly what's good for your spouse because I am not his physician. I don't know what medications they're on. I don't know the medical history. So it would be really difficult to discuss this. But since you have access to the medical dispensary, perfect thing is to go back to the doctor that gave you the medical access in the first place, and ask them for different recommendations. When patients come to see me, I don't just give a medical card. I actually look at the medical history, I do a physical exam, and I'll say, okay, these are the products that I recommend. I try to narrow it down for patients. And then I'll also offer nutritional guidance, acupuncture, maybe it's massage, maybe it's a prescription for physical therapy. So that way it's a really all-encompassing approach. We're not just relying on cannabis medicine, but again, we're pulling on all the different levers. Okay. Shah from India, suffering from AS since the last 40 years. I'm up there with you. I'm up there with you. Recently, I've observed that since the last few months, pain started in the head, around the clock, found some swelling near the eyes too. Please advise on pain relief. So again, Shah, it's difficult because we're not face to face. I can't do a physical exam on you. I can't see you. I don't know what medications you're on. I don't know the complexities of your past medical history. Have you had surgery before, or what's going on with your blood work? So really, when you find a health provider, they should be thinking about all those things. I know there are things online nowadays where you can just like buy your medical card for $30 or something like that. And really, it does a disservice. It does a disservice not only to you, but also to the stigma of cannabis. Stigma, we know cannabis has a huge stigma. And if it's not done through the correct routes, if it's done through an agency that's just trying to give you a card and send you off to a dispensary with no guidance, then you need to find a different way of getting it, a different provider. Okay. Where can I find a doctor that's knowledgeable in the use of cannabis? My rheumatologist, pain doctor, PCP, and others all recommended trying cannabis. So that's good. A lot of times, health providers, especially older health providers, are uncomfortable recommending. So at least you're on the right page. So you can actually have an honest conversation with your health provider. So they recommend trying cannabis, but cannot give you recommendations on how much or which cannabinoids to use. So good old Google, if you look up cannabis specialists, integrative cannabis doctors, integrative doctors, functional doctors, those are always great places to look. When you find a physician, you should look at how long they've been doing it, if they also recommend other things to round out, so maybe finding a pain management doctor that not only does cannabis care, but also does maybe injections or has a PT office so that you are getting that support. I think that's the best thing is to find Google. Find it through Google, okay? All right. I think that's it, Jason.
Yes, thank you so much for your time this morning and afternoon. If there are any additional questions that were not able to be addressed, we will make note of them. Please also send any additional questions to info@spondylitis.org, and we will try to get them addressed. But thank you again, Dr. Chen, for your time. We really appreciate your expertise and sharing of your presentation today.
Thanks so much, Jason.